Nzimande is releasing the outcome of the Human Sciences Research Council second part of the public perception survey on the impact of the coronavirus on South Africans. Let's take you there now.
Good afternoon, ladies and gentlemen. Thank you very much. We are about to commence with our media briefing. The Minister of Higher Education, Science and Technology, Dr. Blade Nzimande, will be officially releasing the results of the survey conducted by the Human Science Research Council on the impact and awareness of the coronavirus among South Africans, the virus which we all know that is sweeping across the world, including in our country. The survey comes amidst the unprecedented spread of the virus across the world, which necessitated that South Africa implements the lockdown from the 27th of March to the 30th of April to impede the spread of the virus and the rate of its infection. Minister Nzimande will be giving us the opening remarks to this media briefing, and the Minister is joined by the Deputy Minister of Health, Dr. Pasha, and he is also joined by the Director General of the Department of Science and Innovation, Dr. Mjwaha. We are also joined by our colleagues from the Human Science Research Council that will be responding to some of the questions that will be asked by you members of the media today. They are in Cape Town. Unfortunately, we won't see them, but we'll hear them. However, at home, we'll have an opportunity to see the presentation of the survey that they have done. My name is Ishmael Nisi, and I will be program directing this briefing today. Members of the media, we have shared in our advisory the call number, which is 0800 142 446, and also our WhatsApp number, which is SA COVID-19 Media Update, where you can be able to send your questions there so that the panelists can be able to respond to you. As a norm, you will please introduce yourself and the organization that you represent and give us a brief question from yourselves. And for those that have sent questions, let me pre-warn you that some of the questions will be answered by the researchers themselves, and will share their details so that you can be able to forward those questions to them, as they are not part of this briefing. Without any further ado, I would like to call upon the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, to address us. Thank you.
Thank you very much, Ishmael. As our program director, our Deputy Minister of Health, Dr. Joe Pasha, our Director General of the Department of Science and Innovation, Dr. Phil Mjwaha. Thank you very much for this opportunity. Good afternoon. Before we call upon the presentation to be made, we felt it is important to give this background information. Of course, everyone knows that communities are at the heart of any disease outbreak and health emergency response. With the deep inequalities and poverty that we face as a nation, flattening the curve through social distancing and enhanced practices will only be successful if we understand key social and behavioral factors that make this difficult. The work that will be presented here today is based on social science research and analysis, and it's led by our Human Sciences Research Council, which is one of the entities that reports to my Department of Science and Innovation. And I would like upfront to thank all the partners who were part of this research, as well as the participants themselves. The team will explain, once they take over, how they did this research, but what I want to say is that the research represents a survey that was undertaken between the 7th of April and the 14th of April, and looked specifically at the lockdown as implemented by the President from the 27th of March. But before we can present the outcome of our research, we think that it is important to understand this research as part of a whole lot of other interventions that are being made by the Department of Science and Innovation as part of the fight against COVID-19. As soon as the gravity of COVID-19 came to light, the Department of Science and Innovation sprang into action, engaging its entities, including the HSRC itself, which will be presenting today, to determine how they could respond and how to coordinate the contribution of the National System of Innovation in dealing with this. Our National System of Innovation identified the following potential research and innovation projects or activities on which to focus: diagnostic tests, targeted surveillance of the virus, therapeutic trials for treatment, vaccine development, data and evidence, including involvement in the production of ventilators. Programs that are contributing to what we are doing through our National System of Innovation include the Strategic Health Innovation Partnership, the South African Center for Epidemiological Modeling and Analysis, the Center for the AIDS Program of Research in South Africa, which Professor Slim Karims is working with, the Center of Excellence for Biomedical Tuberculosis Research, and our technology stations programs. And our entities that are involved is the Center for Scientific and Industrial Research, the Technology Innovation Agency, the Human Sciences Research Council, as I have said, the South African Medical Research Council under the Department of Health, our South African National Space Agency, and the National Research Foundation. Very briefly, some of the work that we are involved in our fight against COVID-19. Much as there are no COVID-19 vaccine trials that are being undertaken in South Africa, two of the vaccines being investigated are based on plant expression systems that we have a connection with. The Center for Scientific and Industrial Research and the University of Cape Town are using these technologies and have proven their ability to locally produce vaccines in plant-based expression systems. South Africa is also participating in an international study of treatments for COVID-19 in hospitalized patients who are receiving drugs believed to have an effect on the respiratory disease. The Solidarity trial that is coordinated by the World Health Organization, whose main objective is to provide reliable estimates of the effects of some of these treatments. As South Africa, we are cooperating with this. We also would like to point out that Nevertheless, until there is sufficient evidence, the World Health Organization has cautioned against doctors and medical associations who may be recommending or administering some of these treatments that are still under investigation to patients with COVID-19. We are, as the Department of Science and Innovation, together with the South African Medical Research Council, in discussions with Medicines for Malaria Venture to explore the effectiveness of other anti-malaria and TB drugs against COVID-19. To put this simply, we are part of tests and experiments that are testing drugs that are treating other diseases on whether they are actually responding in treating coronavirus. As South Africa, we are part of that through our Department of Science and Innovation. We have also created a platform which we call the Dashboard, at which we hosted our President and Deputy Minister Patla was there as well at the Center for Scientific and Industrial Research, a dashboard that collates all the statistics on COVID-19 throughout South Africa. As we speak now, we know exactly which cities have got how much people who have actually contracted the virus, how many people have been treated and recovered throughout the country, including in every locality. And that is being done as part of our work in the department to deal with the problem. We are also working with the Department of Public Works and Infrastructure to deploy products of our own research, fuel cells, which we're already rolling out, which are earmarked to provide energy in areas that do not have the required energy. Our department is also part of a number of other international initiatives. We, however, do need to emphasize this, that as yet there is no treatment and that there is no vaccine against COVID-19. That is why this social science research we'll be presenting now is trying to understand how people are reacting to the virus, how people are reacting to the lockdown and other measures that are taken to the government, so that we understand better what our people feel and how they think, so that we are better able to work together to confront this virus. With those words and background on the work that is being done by the Department of Science and Innovation, of which the HSRC is one of our entities, let me then allow the presentation by our researchers led by Professor Crane Sodin to share with you the results of the research that we have done. Thank you very much.